Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a fascinating show you'll want to stay tuned in for. We're talking about comprehensive spine health, common ailments, treatment options, and the best choice for you, plus the steps you can take to decrease your odds of needing surgery. We'll be joined by a panel of leading health professionals in this field, hearing patient stories of success and taking questions from our live studio audience. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at spine health with the team at St. Luke's. Stay tuned. Thanks for being with us. Let's get started. We have a fantastic panel of guests joining us. Meet Dr. Giovanni Stracco, a doctor of physical therapy and director of the spine program for physical therapy at St. Luke's. Dr. Stracco specializes in manual physical therapy and believes that a hands-on approach coupled with evidence-based medicine is the best way to ensure excellent patient care. He's been practicing martial arts for over 20 years and enjoys nothing more than spending time with his family and helping patients heal faster.
I got into physical therapy after having an injury myself. I spent a lot of years in a lot of pain. I had help from physical therapists, so it seemed like a good fit for me. The most rewarding part of my job is helping people, obviously. When you have someone who comes in who is in tremendous pain or has sought other care and has failed, to get that person better is tremendously rewarding to me. The comprehensive spine program, it surrounds the patient with the clinicians that need to be treating them. It will definitely increase satisfaction of the patient too, as they get back to work, as they get back to their daily function, their normal life as they desire.
Welcome. Thank you so much for being here.
Thanks for having me.
Explain to us and the audience at home, what is the comprehensive spine program at St. Luke's?
Right. St. Luke's has developed the comprehensive spine program to offer a better approach to treating patients with lower back and neck pain. It's the only program of its kind in the region to utilize physical therapy as the first option, which can help avoid unnecessary surgery or imaging. Our team can connect patients with additional services as needed to help our patients feel better.
Excellent. Thank you so much for being here with us.
Thanks for having me.
Joining our panel next is Dr. Balabo Sekunbi, an orthopedic surgeon with St. Luke's Orthopedic Care, with a special focus on spine concerns. A graduate of UMDNJ Robert Wood Johnson Medical School, Dr. Sekunbi completed his internship and residency at Temple University Hospital and his fellowship at the Hospital for Special Surgery. He believes helping people find positive solutions to their spine pain can truly help them live a full, happy life.
I always tell people I didn't necessarily choose medicine, medicine chose me. So the comprehensive spine program here at St. Luke's is exactly what it is, a comprehensive program. It's multifaceted. It's a program comprised of several different types of doctors and providers who help provide the entire gamut of spinal care to patients in need. There's nothing more gratifying than having a patient come in with severe sciatica who can't walk, who's tried the simple things that haven't worked, and then we perform a minimally invasive technique, for example, and within 24 hours they have resolution of pain and they're able to function and return to activities, including work. I think we have state-of-the-art facilities combined with compassionate doctors. That combination of factors, I think, is a great place for people to experience medical care.
Thanks for being here, Dr. Sekunbi. So you're an orthopedic surgeon. Tell me your role within this team approach to comprehensive spine care.
Sure, so I'm an orthopedic spinal surgeon by specialty, and I'm sort of the last stop, if you will. When patients come through the system with a variety of issues, they go through the most conservative means to manage their issues first. We, as a team, then recommend that they come see me to provide them surgical options for their problems.
Excellent, so they really have a variety of stops before they make, potentially before they get to you.
That's accurate.
All right, we'll learn more about that in a little bit. Thank you for being here. Let's meet our final panelist, Dr. Jason Erickson, a pain specialist who is part of the St. Luke's Spine and Pain Medicine Associates at St. Luke's. Dr. Erickson became interested in a career in medicine and specifically the rehabilitation process after a mountain biking injury when he was younger. Following his training as a physical therapist, he went on to osteopathic school to become a doctor. He completed a physical medicine and rehabilitation residency and an interventional pain management fellowship at the Mayo Clinic. When Dr. Erickson isn't practicing medicine, he enjoys spending time with his family, mountain biking, and golfing. He believes the greatest gift he can offer his patients is hope.
As an interventional pain physician here at St. Luke's, I see a lot of patients with chronic pain and also patients with acute pain. The most rewarding part is seeing people respond to the therapies that we do, getting them back to function and meaningful activities that they want to be able to do, whether it's spend time with their families or get back to, their jobs, or just making sure that they return to the activities that they want to do. At St. Luke's, the comprehensive spine pathway will help get patients where they need to be at the appropriate time without wasting time. So it makes me feel very fulfilled and gratified in choosing this specialty when I can see someone respond to our treatments. Even if that means that I need to refer someone on to one of our spine surgeons, to see the patient come back and have them be grateful for the outcome that they have had is very rewarding to us.
Dr. Erickson, chronic pain, specifically back pain, can be so debilitating and life-altering. What is your role as a pain specialist, and at what point in the process do patients generally see you?
So patients will generally see me after they've been through some of the conservative care options with physical therapy and through their primary care physicians. My role is to then look at different options, which may include interventional approaches or different medications that they may not have tried yet.
Thank you all for giving us a better basic understanding of your roles and your team's roles to spine care. Coming up, we'll dig deeper into how the panel works together to solve complex medical issues and how back pain and injuries can be treated in a variety of ways. Some may surprise you. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
I began experiencing pain about 13 years ago when I was practicing a certain yoga pose and fell out of it. The area around my neck and almost my jaw area was just not getting any better. I found Giovanni Stracca, who is wonderful at St. Luke's and super knowledgeable, and he has over the years, every time I've had an issue, been able to resolve it within a few weeks of just us working together and me doing some exercises at home, but mostly his manipulation and care at St. Luke's. St. Luke's Comprehensive Spine, I feel, is just super effective and a really great asset for us as patients because you can get immediate attention, immediate relief, and start solving the problem that you have been probably enduring for a while in no time at all.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our audience for being here and for providing us with questions, which we'll get to later in the show. Joining me is a captivating panel of medical professionals, Dr. Giovanni Stracco, Dr. Balabo Sekunbi, and Dr. Jason Erickson. We've discussed the comprehensive spine pain program at St. Luke's and their individual roles. Now let's get a better understanding of some of the treatment options available. Dr. Stracco, how common is back pain, spine pain, neck pain? You do hear people kind of complaining pretty regularly about this kind of stuff.
Absolutely. It's the number one diagnosis we're seeing is lower back pain. 9 out of 10 people will experience some form of back pain throughout their life. So having physical therapy or physicians that are ready to treat it is absolutely paramount.
And what are some of the causes that you're seeing for this pain?
Right, so it can be anything from young athletes, sports-related injuries, the typical weekend warriors hurting themselves, doing gardening. It can be chronic situations, chronic back pain with the elderly. It can be all kinds of different things.
You know, Dr. Sekunbi, I know you see patients for a variety of injuries, not just spine, although that is your specialty. How do you assess when there's sort of a pain issue and a back management? How do you assess that and decide that that's what they really are experiencing? Maybe they came in with leg pain, but could it be coming from the back?
Sure. So my job as a surgeon is to figure out, as a detective, the exact source of their pain issue. It's really about patient education, understanding the anatomy, understanding the injury, understanding the mechanism of their issues, and combining that with diagnostics such as x-rays, CT scans, and MRIs. Ultimately, all that information allows us to formulate a plan for the patient.
Excellent. Dr. Erickson, what is the difference? Explain to us acute pain and chronic pain. What's the difference and how do you know what you're experiencing?
Sure. So acute pain is something that would happen after someone did some type of activity and they developed pain. They might be able to refer back to that specific inciting event or perhaps a trauma. Acute pain turns into chronic pain by most definitions after about 3 months. So the acute phase of pain is really our body's way of telling us that there's some type of tissue trauma or some type of injury that needs to be evaluated. Once that goes on past 3 months, that pain is really felt to not really give us the warning sign anymore, and it's really not helpful pain anymore. So at that point, we're really looking for ways to manage the pain differently.
Dr. Stracco, so many things that happen can require a variety of treatment options, but why is physical therapy often recommended as the first line of defense, especially as it pertains to spine and back pain?
So we always want to try conservative measures first. Physical therapy is the most conservative measure you can attempt. We're not giving people medication necessarily. We are doing things that are utilizing their own body. We're doing manual therapy with patients, exercise, stretching, all kinds of things to help them reduce their symptoms and return them back to their daily function without doing things that are invasive, basically.
And of course, they don't want to live with that pain anymore.
That's right.
Dr. Sukumbi, you often have to be the one to tell a patient they might need surgery, but St. Luke's has an interesting philosophy called the cut last philosophy. What is that, and how often is that a reality for patients?
I would say about generally 80% of the patients I see don't need surgery. They're able to be successfully managed with non-surgical treatment options. And we really truly abide by that philosophy because I believe if a patient commits to the program, such as with therapy, activity modification, understanding their bodies and understanding the triggers and staying away from certain things that might exacerbate their pain, they're usually successful in being able to overcome that acute pain problem.
What are some of the misconceptions around pain management, and when is a person a good candidate to come see you?
So some of the misconceptions are perhaps that every pain needs to be treated with a pill or perhaps an opioid. Certain acute injuries do require strong pain medicines, and opioids may be indicated for those types of things. What we're learning now is that as patients use these medications longer and more chronically, they get into other problems with those medications. So developing dependence on the medication, tolerance, and having side effects that go along with that, and then having difficulty coming off of those medications. So those are things that we're always keeping an eye on and trying to be mindful of. So if we can limit some of those side effects from those medications by using interventional options, having physical therapy on board, then we're able to keep the patient safer.
Dr. Sukumbi, how many injuries are you seeing coming in from people kind of overdoing it, or from people who perhaps are aging a little bit and have lost their balance or have fallen? I know St. Luke's has some wonderful programs really to help seniors with their balance and keep people safe in their homes.
Sure. In my practice, I see the entire gamut of the age spectrum. I see adolescents who have sports-related injuries. I see middle-aged individuals who have just everyday activity-related injuries. You're in the garden, you twist the wrong way and you have an acute pain issue. Sometimes in the elderly patients, they develop arthritis that could result in issues such as stenosis, such as pinched nerves. And in these cases, these patients will present with pain. So we do see the entire gamut of patients from adolescents to the elderly.
Insightful information from all our panelists, but we're not done yet. After the break, we'll learn more about the role of technology and communication in the healing process. You're watching St. Luke's Health Now.
I woke up on a Sunday, the week before Christmas, with an incredible amount of back pain. I was recommended to go through physical therapy, as a second line after I was not having any luck with oral steroids. My first meeting was with Steve. He said, we want to concentrate on getting this side of your body and this side of your body, as far as the nervous system goes, to kind of interact differently. We began my physical therapy at the very first appointment. I was, not immediately, but gradually and regularly feeling progress. This is the practical next step to relieving your back pain. And I found, in my case especially, that's what did it. It worked.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have an interesting show tonight. We're talking about the comprehensive spine program at St. Luke's. Back and spine pain affect a lot of us, and the variety of injuries and treatments are vast. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Giovanni Stracco, Dr. Balabo Sukunbi, and Dr. Jason Erickson. Thank you all for being here. In the first part of the program, we talked a little bit about the prevalence of spine and back injuries, some of the patient care options, and the role that each of you play in the healing process. However, technology and communication are so important. Let's get into that and discuss that now. So Dr. Erickson, how do you as a pain specialist make sure that you're communicating with all of these various members of the team, including primary care physicians and anyone else that might be necessary, to make sure that your patients are receiving the best care possible?
So the first option there is our electronic medical record, which each of us have access to, and we all can see what everybody has evaluated, what our treatment plans are, what medications have been ordered, what studies have been ordered, and what therapies have been completed. I work closely with Dr. Stracco, Dr. Sukunbi. There's plenty of ways for us to contact each other, and we do that frequently on at least a weekly basis, if not even daily.
Dr. Sukunbi, when it's time for surgery, how do you know that that's the best and only option for a patient? And at what point do you assess and communicate that with the patient?
Sure. So the decision for surgery is multifactorial. It depends on what the patient's symptoms are. Almost every patient at some point will always have pain, but some of the things that I look for as red flags are things such as weakness in the arm or in the leg, for example, or other associated factors such as problems going to the bathroom, for example, incontinence or retention of urine. These are some of the red flags that we try to tease out during the history and physical, combined with the fact that if they have tried and failed conservative management, sometimes surgery then becomes the best next option.
And as you mentioned earlier, really only about 20% of your patients end up needing surgery, so people shouldn't be fearful to look into those options.
That's right.
Giovanni, often they come to see you and your team first. How do you know when it's time to refer for, maybe medicine management or a surgeon? At what point in the process do you say, okay, we need to move on?
Sure. So it might be immediately. When patients come to physical therapy, especially if they're coming through the St. Luke's Comprehensive Spine, we are triaging these patients. So we are evaluating them, and we are also determining if they have red flags, if they should be in Dr. Sukunbi's office or Dr. Erickson's office. There are certain presentations that we would see on their initial evaluation to warrant a referral.
Dr. Sukunbi, how has technology helped you in orthopedics? What types of procedures can you do now that you couldn't even do 5 or 10 years ago?
That's a great question. Technology is forever evolving, and there's several ways that we can accomplish the same goals in more efficient manner than we couldn't do before. For example, we now have techniques that are minimally invasive, muscle sparing techniques, whereas 20 years ago you would have a big incision which would require long recovery. Sometimes we're now able to accomplish the same goals through smaller muscle sparing incisions. And the equipment we use is better. The instrumentation, the technology has allowed for the equipment to be better. We're able to accomplish the same goals in a more efficient fashion.
And then, of course, if someone does go through surgery, of course, they're probably seeing both of you as well post-surgically to get them up and moving even faster. Dr. Erickson, medicine is evolving with technology also. So tell me a little bit about how that's affected pain management and what technology and medication has allowed you to do.
Sure. So one of the major advances in interventional pain management technologically is the tremendous growth and advances in spinal cord stimulation. So we've come from an area where there was really just one type of tonic stimulation where patients would feel a paresthesia, or basically a buzzing in their limb, which would hopefully mask their pain. Now we have different waveforms where patients may not feel anything. They're not having to recharge batteries. They're able to get back to their life, and we're able to manage their symptoms even better and with more focal or more precise techniques. So it's been really an amazing leap, even within these past 5 years. And these things also allow us to minimize the oral medications. A lot of times we talk about medications that you take orally being maximally invasive because they affect your whole system, whereas we can provide these minimally invasive technologies that really help to maximize function, get patients where they need to be, and minimize their pain.
Giovanni, what is the typical course of time someone can expect to see a physical therapist? Is there something typical, or is it very case by case?
It is very case by case. We may see patients who fit into an acute situation where we might only see them 1 or 2 visits. We might do a manual technique on them and then maybe see them for a follow-up after we give them a home exercise program or a home program, and that may be it. There are patients with chronic situations or more problematic issues that we could be seeing for 2 months possibly. Everyone's a little bit different, but we take case by case and we treat patients accordingly.
It's truly the definition of individualized care, and I can see that all of you take that approach, and it's a step-by-step basis in the Comprehensive Spine Program. Thank you so much for all of this information. We have had a really engaging conversation, and up next, we've got questions from our live studio audience. Stick with us. You're watching St. Luke's Health Now.
Before I came to St. Luke's, I had pain for almost 9 months. I was stuck in spasm from my cervical spine to my lumbar spine. I was referred to St. Luke's from a physiatrist outside of the St. Luke's network who highly recommended Giovanni. From the moment I got to St. Luke's, I absolutely loved it. Everybody from the front office staff to Giovanni to the other PTs that were in there, everybody was super helpful, friendly, and inviting. He tested me in different ways to see what was triggering the pain and set me up with a plan of care to move forward with. He was able to stop the spasms from happening. Thank goodness Giovanni helped me get back to my normal schedule. I was able to return back to the gym, and I hope that patients can find this resource very earlier in their treatment pathway, then so they can start feeling better sooner.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to all of our audience members and especially our patients for sharing their stories with us. And of course to our amazing panel of specialists. Thanks for being here. We've had a good conversation about treating spine pain and St. Luke's unique approach. Now we want to take questions from our studio audience. Our audience member asks, is there an age at which you would advise not proceeding with a spine operation due to increased risks of age?
That's a good question. I look at age in 2 different ways. There's the normal age of the patient and something I call physiological age. Sometimes a patient comes into my office and they may be 80 years old, but they look fantastic. And physiologically, I feel they're 60 years old. We don't necessarily make the decision to make surgery based on age alone. It's really based on what the surgery is, what the need is, and whether or not they can even tolerate it. So we usually employ a comprehensive approach, including their primary care doctors, asking their opinions. Do you think this patient is safe enough for surgery? So it's not an age question, it's really what is the issue, what is the potential benefit, what are the risks? And these are conversations we have together with primary doctors and the patients, and together we make a plan.
So very individualized. All right, another audience member asks, what advice do you have for weekend warriors to decrease back injuries?
I could answer that one, sure. So staying fit, staying healthy as best you can, working on things like core stabilization, flexibility, doing exercise in a healthy way, not just, once every month you're going to play football with your friends or basketball with your friends. Health is something that you have to maintain consistently and constantly, and it's frequently the people that we get these weekend warriors that are getting injured are people that they don't necessarily do much, and then they run out and they think that they can run a 5K all of a sudden.
And maybe they need a little stretching before and after.
Sure.
Never hurt anybody.
Right, never hurt anybody.
Good. All right, the next question we have is, we hear about new approaches such as minimally invasive and robotic-assisted surgery. Some doctors may not be embracing or be fully trained in these. Is it advisable for patients to see a surgeon who is fully trained and experienced in these procedures?
I think understanding what the pain generator is and what you're trying to accomplish is probably more important. There are many ways to skin a cat, and there are many techniques that are just as effective. I think every surgeon employs the most minimally invasive technique that they can to help you achieve your goal. I would be wary of just marketing tools to draw people in when it comes to minimally invasive surgeries, but it's really a discussion with the surgeon and just being comfortable that the surgeon is comfortable taking care of the problem. I think the end goal is the same: alleviate your pain, return you to activities of daily living. But it's a discussion you should have with your surgeon, but I don't think it's something you should really worry too much about.
Great. Another question we have is it always necessary to get x-rays or an MRI to figure out what's going on?
I can answer that. Frequently, patients come to us with no imaging. We do a full assessment of a patient, and using special tests and patient history and their symptoms, we can determine pretty quickly if they need imaging or not.
Excellent. What is the difference between an orthopedic spine specialist and a neurosurgeon?
That is a great question. For purposes of the Comprehensive Spine Center, for the layperson who's coming into the program with acute pain, there is no real difference. Both specialists are trained to treat disorders of the spine. They go to medical school, they go to extensive training programs where they learn techniques. There's sometimes a difference in philosophy, but they're both equally trained and board certified in treating spinal disorders. So for the purposes of the Comprehensive Spine Program, there is no difference.
Excellent. Thank you all for being here. We have learned so much, and I think the main thing we've learned is that there are a lot of ways to get treatment at St. Luke's through the Comprehensive Spine Program, so there is a lot of hope out there for patients. Thank you all for being here. For more information on the Comprehensive Spine Program at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.